Chronic widespread pain and fibromyalgia syndrome. So, chronic widespread pain is defined as musculoskeletal pain, multiple locations. Yes, so we do not have a pain in just one place. We have a pain that is happening in multiple places, and this generally represents the generalized body pain. Fibromyalgia syndrome is a subset of the chronic widespread pain. Yes, so the fibromyalgia, when we have the chronic widespread pain, the fibromyalgia is the subset of it. Yes, so we have a subgroup of it, and this is characterized by the chronic widespread pain, hyperalgesia. Yes, so increased feeling of pain. Let's say that it's easier to invoke pain in a patient, and host of other functional and mood disturbances. Yes, so we also have the psychological part, such as fatigue, poor sleep, cognitive problems, depression, and anxiety. Something about the diagnostic criteria. Yes, so criteria must be met. Other disorders that would explain the pain must be ruled out. Yes, so symptoms must be present for minimum of 3 months at a stable level. Widespread pain index and symptom severely. Generally, we need to have some pain in in these areas. Yes, so we need to have them. Maybe another way. How to say that the pain is widespread? How to say that it is in more than one area? We need to specify the areas and tell in how many of them we have a pain. Yes, so shoulder, lower arm, upper leg, jaw left, upper back, shoulder girdle right, and so on and so on and so on. So we divided the body into some sections, and we need to establish in how many of them we have some pain. And it will tell us whether the pain is generalized, whether the pain is nearly everywhere, or the pain is just in some particular places. Areas where the patient complain of pain. This is what we already taught. Severity of the symptoms. So how severe are the symptoms? So not only where, but also how severe. And also whether we have some additional symptoms, yes, and how severe they are. And here are just some points, tender points that we can check whether they are present or not in case of the patients. Presence of them will point us into the diagnosis of the fibromyalgia. What is the epidemiology of these disorders? So prevalence is ranged from 4 to 18%. Yes, so this is a very widespread prevalence. Yes, this is the very widespread number. So what it points us? It points to the situation that it's really not known how widespread it is. Because the diagnosis is not easy, because as we know, there are a lot of pains that we feel every day. Yes, and usually they are not so important. But there is frequent that something will be painful in the back, that something will be painful in the hand, and so on. Just some minor things that we would not care about. At least you will feel it as you will be as old as me. So this is not so problematic, and this is very common, but is this fibromyalgia? Usually not. However, when it is not so clear to tell. But we are now talking about occupations and whether the disease is related to occupation. So we know that certain occupations may have higher prevalence of the widespread pain. For example, in case of the home care workers, the work centralized. This disorder is more prevalent. Another occupation is the military personnel, who are often exposed to extremely volatile physical and psychosocial situations, and this may lead to fibromyalgia. It's because we know that there is some strict correlation between the psychological factors and the death in fibromyalgia. So The etiology of this disease is unknown. There are several factors, however, there may underlie these conditions. So, there may be some involvement of the peripheral and central modulation and neuroendocrine dysfunction. Also, some dysregulation of the stress system. Yes? Peripheral hypothesis. So we have different idea that the peripheral abnormality muscles may play a role. Yes? So we may think mainly about the nervous system, or we may think mainly about the muscles. In case of the neuroendocrine hypothesis, we think mainly about some serotonin, about some hormones and other biologically active substances that are released in the body. In case of stress system hypothesis, generally we know that the acute stress is something that is aggravating the fibromyalgia. Hence, there is some idea that it affects the our nervous system. It changes it in such a way that it will lead to signs and symptoms. And how the fibromyalgia is related to work disability? Generally, fibromyalgia as pain of many areas of the body may lead to severe problems with performing the work efficiently. Hence, it is quite important factor for the work disability.